Good morning and welcome to Ask Dr. Murphy, This Week in Public Health. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
Doing quite well. Just the end of July here.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. Today, Dr. Murphy will be addressing the latest headlines through today, July 31st, and we welcome any questions or comments down in the comments below or at any of our social media. Starting today with the big weeks-long story, the Cyclospora outbreak. Can you bring us the latest numbers, Dr. Murphy?
Cyclospora, is this parasite. It's been associated with farming, with different food products like shredded lettuce is the kind of leading culprit now, but also with different berries and the like. Most of it imported from Central America. So anyhow, we're up to at least 18,000 suspected and confirmed cases. Over 10,000 of those are from the state of Michigan. Michigan has done really the best job. If it wasn't for Michigan, this thing would have even gotten out of hand even greater than it is because the CDC took off Cyclospora as a reportable infectious disease just months before this epidemic has started. So they made it voluntary, but a lot of the states just kept reporting it anyway, like Michigan. So thanks for Michigan to at least get this thing identified. And the cutbacks and disorganization and stuff at the CDC is not helping. Let's just put it that way. But anyhow, the Michigan is still having lots of cases, nearly 400 since their last report. The CDC has reported cases in 45 states. Basically, almost the entire United States now is covered with this stuff. And the good thing is that it generally doesn't kill you. It doesn't get so serious. But I mean, if you're older and frail, whatever, this diarrhea could get you dehydrated. It could be bad. But generally, people survive it. The big part of this, besides just having a couple of days of diarrhea, like you're on one of those cruise ships, which causes another thing, that's norovirus. 40% of US adults are buying or eating less produce as a result of the outbreak. That is a huge shift in our regular habits. Now, if you're not eating vegetables and produce, is that really good for you? Well, in the short term, it's probably not going to make too much difference, but in the long term, it could have a really big difference. But what it has a huge difference in is in the whole food supply business, because all of a sudden people are not buying the produce. So this is having an enormous economic impact on the food distribution system. So a lot of them are linked to this Taylor Farms company in California, who has an affiliate in Mexico, and looks like it's associated with shredded iceberg lettuce. But there could be other sources because there were definitely people who had no contact with any lettuce of any kind. So they don't know. But this is really a fascinating outbreak, and it's one of the more difficult ones to trace. It's a parasite, so it doesn't like grow in a culture. You can't just you have to actually do a specific test for it. But if you've got some bad diarrhea now, make sure they test for cyclospora.
Yeah, cases continue to grow, as you mentioned. And also with the state count, something interesting is that those Taylor Farm recalls only affected 27 US states. And like
Right.
you said, there are cases in 45 states. So the FDA is continuing to look for other sources of contamination. But yeah, wash your produce very well if you're getting it, just in case.
Well, the recommendation really is to avoid the pre-shredded packaged lettuce. I think is probably a good idea now. Buy a whole head of lettuce if you want to have lettuce. Take the outer leaves off. Wash the the rest of the lettuce well, and you should be fine.
Very good to know.
Mhm.
Now, something else that we reported on last week is this salmonella linked recall of millions of eggs here in the US. At the time, we thought that there weren't any actual salmonella cases associated with that recall, but that has changed. Can you tell us?
Yeah, so we reported last week or the week before 19 million eggs, 1.6 million cartons, a dozen in a carton, um, were contaminated. So this was a good pickup because at that time, no cases had really been reported of salmonella. So it was a good prevention effort to avoid this. However, the FDA now has gone back and looked a little more closely, and they found that 98 individuals were infected between November 21st and June 30th. No deaths have occurred. Salmonella can kill you, but 26 people were hospitalized. So, if this thing had gone undetected for longer, this could have been a real disaster. 19 million eggs. It's really amazing. So the culprit, one of them anyway, is the Midwest Poultry Services of Indiana. And so they have issued recalls, but this doesn't account for all the illnesses. So that's just one that's been easily identified. So the good thing about Salmonella, it's a bacteria and you can culture it. It's relatively easy to identify. So a lot of these states are in the South and a little bit in the West, Texas, Oklahoma, Arkansas, Louisiana, New Mexico, and Mississippi. And they've been several brand names have been purchased and they put their own brand on it. But they've been sold at stores like Kroger and Berkshire grocery stores. So, regular establishment stores. So check your eggs. Make sure it's not from this Midwest Poultry Service and be very careful.
Absolutely. Good advice there. And something that we talk about a lot during the respiratory season, but not as much over the summer, is RSV. But I understand there's been a great study published about the RSV monoclonal antibody for infants and some benefits that we didn't expect. Can you break it down for us?
Yeah, so this is a study from France. France has a very centralized healthcare system. Everything, it's kind of like our Medicare program, but it is for everybody. So they have records on anytime you go to the pharmacy, anytime you go to a clinic, even if you're out of the government system, you're still actually reported because the government is partially paying for even the private systems. So they looked at 528,000 infants born in France in 2023 to 2024 who received Beyfortus, which is nirsevimab. That's as the monoclonal antibody against RSV. It's an incredible treatment to prevent RSV in young infants. It works great. There's also a vaccine that you can give the pregnant mother. It even works better than that, but very close, okay? So anyhow, it works terrific. It's RSV is one of the leading causes of early childhood infant hospitalization. So anyway, they followed those kids and they found an interesting unrelated fact. 36% less likely to be hospitalized for invasive pneumococcal disease, pneumococcal pneumonia, streptococcal pneumonia, which is another potential killer in young children and in adults, that correlated with the time that the antibody stays present, which ultimately goes away, this protective effect. So why would a monoclonal antibody against RSV protect you against pneumococcal disease, which is an unrelated bacterial disease? So they can only speculate, but they're not really quite sure. But the same thing happens with flu. So like if you get the flu, you can get a secondary bacterial infection after you have the flu. That can be devastating. That can kill you versus surviving the flu. So it may have something to do with the protective effect of not having these RSV infections. This is just pure speculation. We don't know. But anyway, it's an incredible finding. And it takes a system, big centralized system like that, because they have everybody. They have the infant, they have the pregnant mothers, they have the infants, they have the children, the adolescents, the adults, the old people. Everything is in that one system. So they just it's a great source of information for population studies like this.
Very, very good news there. And something that, has some good news and some not good news is the Ebola outbreak in the DRC and in Uganda. Can you tell us about that?
Yeah, this Ebola outbreak is now up to 3,262 confirmed cases and 1,437 deaths in just 10 weeks. That makes this the fastest Ebola epidemic ever reported. Now, it's not the biggest yet, but it's the fastest growing. Very unfortunate, very fast moving, still new cases all over the place. And it's primarily in the Eastern Democratic Republic of the Congo, the DRC. It's a very unstable place. Clinics have been raided and robbed by roving militias, bandits. Payments haven't been made. Workers have gone on strike. This is hard work. All right. And it just complicates everything to no end. So there had been spillover cases in Uganda, and Uganda has actually a very good public health system, and they have a lot of trained healthcare workers, including physicians who've been trained by the United States, United Kingdom, and others. And they're in pretty good shape on the public health side. And so they had a couple of cases, but there hasn't been any cases in over 42 days. They had 20 cases in total and 2 deaths. So, but it's basically the spillover there is over. Now, in the last epidemic in 2013-14 in Western Africa, the same thing happened around the 3 countries that had the infection. You may remember Liberia, Guinea-Conakry, and Sierra Leone really were ravaged by Ebola. And they have very, very poor infrastructure at the time. Okay, they've gotten better. Nigeria got a case, and that person ultimately infected 20 people, but it stopped there. Mali got 8 cases, stopped there. Senegal got 1. So why did those countries not take off? Because they have decent public health infrastructure is really the answer. So Uganda's kind of out of the woods with this, even though they're still on the list of high risk places. They should come off.
Yes, thank you for keeping us up to date with all of those cases, and nice to see at least a little bit of good news coming out of that story. Another story that we have been following that, again, has some not so good news is the risk of HIV resurgence that we've seen this year. We talked about the funding last week as this AIDS conference is ongoing, but can you bring us the latest?
It's a very sad story, actually. AIDS has been very difficult to control. We still have more new cases than deaths worldwide. But we were going in the right direction. Those numbers were getting very close. As soon as you have more deaths than new infections, the whole epidemic or pandemic, whatever you want to call it, starts to basically go away. And that has always been the goal. And you try whatever you can. Prevention measures, this, that, whatever. There's no vaccine, of course. So what happened? So the funding fell 18% to $7.3 billion in 2025. That's the lowest level of funding in over 2 decades, or nearly 2 decades. This funding decrease is driven largely by the rollback in U.S. support, which previously accounted for 75% of all international HIV funding. We were a huge player in this area. This all goes back to PEPFAR and George W. Bush and just the American Congress and the American people supporting all this. So this has resulted in the prevention treatments dropping by 50% in many countries, and clinics having to close and people dropping off therapy, and they're having a huge decrease in the number of people being treated. And so means that the whole thing is going to go up again. Now, there have been adaptations. The other countries are scrambling to find other funds. The high middle income countries are doing pretty well, but even the low middle income countries are doing okay. But it's the low income countries that are really getting slaughtered because they just don't have they don't have the resources. Low income is like approximately $1,000 per year per person. It's very low. So anyway, firmly off track.
Yeah, firmly off track and such a shame. But our final story today is a very interesting one as we get to the height of tick season this summer. There has been an emergence of babesiosis, don't think I said that correctly, up in Canada. Can you break it down for us?
So babesiosis is another little parasitic disease. We call it North American malaria, is kind of its nickname. Very common in New England. No, not very common, but it's reported in New England. So that's why you don't hear about it here in the Midwest. And this is reported in the New England Journal of Medicine, the #1 medical journal in the United States, one of the top in the world. So what they find? They found 11 confirmed cases in Nova Scotia, Canada. So it's even further north out into the ocean. And they found 11 confirmed cases. 8 cases were locally acquired, no travel history. They didn't go visit some cousins in New England or anything like that. And this is all because of the expanding Ixodes tick, which is spread by this tick distribution, which is driven by climate change. So the world is warming. The ticks are going up. They can survive further north. And they still have much fewer cases than they do in Maine and Vermont than the New England states. But this is it's expanding up into the eastern provinces of Canada, it looks like. So it's interesting that the New England Journal picks it up because this is where they're based. This is like one of their home diseases that they have to worry about. So that's the story on human babesiosis.
Yes, and another reason to do your best tick prevention, and I always say your best mosquito
Yeah.
prevention as well.
Well, we're in high summer season, and that's when people go to New England, Cape Cod, Maine, Vermont, whatever. So it's very high season for tourism there.
Absolutely. Well, thank you so much, Dr. Murphy, for your time and your expertise, bringing us all that is important this week in public health.
Well, thank you, Katie.
And thank you all for joining us. We hope to see you again next week. And as always, any questions or comments are welcome down below. As a reminder, if you'd like to see Dr. Murphy's resources straight in your inbox, you can subscribe to his Substack for free. Link is in the description. We'll see you next week.